Hey, deserving listeners, this is part 2 in me reacting to Andrew Tate Goes to Therapy, and this is on the YouTube channel called Cobra Conquer. Let's watch and see what happens.
Which is going to allow me to be a fearsome competitor in all realms of human endeavor.
Mm-hmm. Have there been some of your beliefs or convictions that have been challenged through the experiences that you've had, particularly in the last, recently?
Well, people challenge me often. And what a lot of people don't understand is that
Yeah, so David Sutcliffe was asking, I believe, what he was asking was, have any of your beliefs that you had prior to all the things that have happened to you lately, has reality challenged those such that you've changed your beliefs, or have you challenged your own beliefs at all? That's what David is asking, I think. That's a kind of a good question to ask given where Andrew Tate was headed. And then Andrew Tate answers it in the way that he did, which is, well, yeah, people are trying to challenge my beliefs, and this is how that they're all wrong. Isn't that interesting that David asked a question about just Andrew Tate? Like, forget everyone else. Just think about yourself. When have you, and maybe David will follow it up with that, but has there ever been a time when you changed your belief based on what was happening to you? And that's kind of like the paradox where people will say, can God make a rock so big that he can't even pick it up? Either answer says that God is not omnipotent, right? And when you ask someone, and again, I have no idea what Andrew Tate's real personality is, but his public persona is the one, it's pretty consistent. And his public persona is such that if you ask him that question, have you ever had a belief that you found to be wrong and you changed it? Then that's in a similar vein, not exactly the same as that God with the rock thing. Because if he, on one hand, it's like, well, yeah, I have full control over myself, so I'm going to change my beliefs. I'm that strong. But on the other side, at some point, he had to have been wrong. So there's no way out of that question. There's no answer to that question that will have his public persona upheld in which he's perfect and he's never been wrong. So he, at the very least, possibly subconsciously, but maybe consciously, just interprets the question in this different way of like, well, yeah, people, and also for people with this public persona, or I just say with this presentation, either publicly or privately, they are very outwardly focused. They're very, very focused on how other people see them. It's really an obsession because they're in this constant state of trying to prove themselves because of what they went through when they were growing up.
I will never adopt the thinking of somebody who is sad, and I will never adopt the thinking of somebody who is less competitive than I am or less successful than I am. If someone comes along and goes, Andrew, you are wrong, the way you see the world is wrong, but they are suffering from an affliction, why would I adopt a single?
And it's also possible, again, it's hard for me not to see this through my therapist lens. If I asked that question to an individual who was presenting this way, and they answered this way, I would wonder if they're actually saying something to me, which often will be the case. Clients like this, especially if they're volunteering for therapy, they don't want to get into a fight with me. That's not what they came to therapy for. So when they have what they perceive to be an attack, and people like this can absolutely perceive it as an attack, that question that David asked, which is, did you ever have a belief that you had to change? It can be very threatening because they kind of know what that's implying. And they also suspect that it's a question that reveals a bigger idea in the therapist's mind that is skepticism of the client's presentation and way of thinking. And so it's very threatening to them. And so some of them will respond in the way that Andrew Tate did by saying, well, yeah, people are always trying to tell me that I'm wrong. But what the client is really saying is, you're telling me that I'm wrong, which isn't what David was saying. But because of the traumas and the schemas and the lens and the reactivity, that's how it's felt. And then the client will triangulate, talk about outside people, but they're really talking to the therapist.
Iota of what they say. So it's kind of funny when I talk about depression, the number of people who defend depression. Depression's ruined my life, it's super real, and I lost my wife and my life is over and I want to kill myself, it's real. I'm like, surely you should like my worldview. If depression's so terrible and it's destroyed your entire existence, you should be listening.
I'm sure this is a straw man that he is constructing, the way he mockingly role plays people that are saying that depression is real. And then his response is just so, it's deplorable too. What it sounds like is someone reached out to him and said, well, I'm really depressed, and your notion that somehow that you can just overcome depression by sheer willpower is not working for me, or is hurting my feelings because basically you're saying I'm weak or something. And so they're seemingly trying to convince Andrew Tate, no, depression is real. Believe me, I've been through some really bad experiences, and now I have a hard time getting up in the morning, and I feel no motivation, and I don't take pleasure in anything anymore. And I need medication that kind of helps sometimes, and I go to therapy and it kind of helps sometimes. But then another bad thing will happen to me, and I can't sleep at night, or I sleep too much, or I'm gaining weight, or I can't eat, or it's a real thing. Obviously, I don't have to tell you that, but for Andrew Tate to create this straw man of someone that's just like stubbornly weak or something, and then he says, well, surely wouldn't you want my perspective? Because my way is better. Just don't be depressed. Yeah.
To me, tell you it's not real. Right. But instead they're defending it and sticking up for it, which I find very interesting. So that's the first thing. In regards to whether I have had any of my convictions challenged, it's kind of amazing. Maybe it's just a semantics trick, and maybe it's that simple. Maybe it's as simple as saying, I feel a little bit depressed today, but I am not a depressed person, and I cannot become depressive. I'm not good.
So actually, what he's talking about is a well-known and established technique in treating people with various different issues, including depression. You can call it cognitive therapy, you can call it narrative therapy. That exact phrase will be used in therapy. I've used it sometimes or proposed it. They will say, I experience depression, but I am not a depressed person. And what they mean by that is, I'm not going to let this become my identity, because if I let it become my identity, then I've truly given up, or I'm truly lost, or everything will be filtered through that identity. I'm experiencing depression every day for the past 3 months, but I refuse to believe that I am a depressed person. Or it can be medical too. Someone can say, I experience chronic pain, but I refuse to be a chronic pain person. I'm not going to be labeled as that. I'm not going to think of myself as that. I experience chronic pain, and it's awful. Another tangent to this is to externalize. Various different therapies use this technique of saying, I am me, and the depression is over here. It's happening at me. And I might even give it a name, like Mr. Poopy Pants, or the demon. I'm just thinking of names that clients have used, or the dark sphere or something. And it helps to say that because for some people, when they're depressed, they start to think of it as being a part of who they are. It becomes infused in their personality. And when, for some, not everyone, but when they do that, then it can be very hard to dislodge it. Even when, for some people, when they actually start to recover from depression, say that they've been depressed for 5 years, 15 years, and they actually go to therapy, they go on medication, they start to emerge. They might, for example, they get invited to something, and as soon as they get the invitation, they're like, I don't go to that, because they still identify as a depressed person, even though if they thought about it, they actually want to go to the thing they're being invited to, but they're operating from the identity of a depressed person. I suspect for Andrew Tate, if he truly has never been depressed, that there have been times when he has felt demoralized and pessimistic and worried about the future, or maybe even wanting to give up, wanting to say, I just can't do it. I can't try anymore. I don't want to fight anymore. I just want to sit here. And then he finds that if he, says, no, I'm not going to give up. I'm going to continue to fight. For him, he's saying that's depression. That's not, I don't know, but if that is the case, that's not depression. That's just demoralization. That's lack of, burnout, that kind of thing. And I think that would be fine if that's what. Now, the asterisk to all this is that if the allegations are even somewhat on the mark, then it sounds funny to say that it's okay. I'll just say it's okay for an individual, independent of the situation that they're in, to engage in that way of thinking if they're trying to get out of demoralization.
Have depression. Maybe it's just a semantics trip. And by saying that alone, I understand that it's a temporary state of mind, which I can alter and I can affect. And I've never struggled with long-term depression or long-term negative thoughts because I don't believe in that mental model.
So I've never struggled from long-term depression. I've never suffered from short-term depression because I was raised very well. And biologically, I'm not prone to that. People in my family aren't prone to that. We're prone to anxiety. I've never had I've never even been close to being clinically depressed. But it's not because I have this magical willpower of some sort. It's genetics, it's upbringing, it's attachment. So he's attributing it to his willpower or strength or something. And I think he's, at the very least, trying to sell his product. Because if he says this, then he can get people to pay for things and he can make more money. But I also wonder if he needs to believe this because he needs to feel like he is superior and special.
Believe in that. I don't think it's possible, so it just doesn't happen.
You said you experienced depression, some form of depression or depressive feelings and sadness in prison. What were the thoughts that were coming up?
So this is a question that I might ask too in this situation. Everything depends on what Andrew Tate, if he were to talk with me or someone like him, what they wanted from me. You might wonder, well, why would someone like Andrew Tate even come to therapy? Well, I'll tell you from memory and also just from research that people who present like Andrew Tate, they might come across like they have everything figured out, and they might consciously believe that they have everything figured out. But the underlying traumas and their defenses and the way they treat other people result often in them having a very hard time getting their needs met, specifically their needs met regarding dependency, interdependency, mutual dependency, and love and attachment and neediness. They deny their neediness very firmly and are very upset if you even imply that they have needs around this, that they have normal human emotions and attachment needs. And so they will go their whole life without getting those needs met, and they will become symptomatic in some way. They might become depressed. They might use a lot of substances. They might feel empty on the inside. They might feel like their life is meaningless. They might notice that they're getting into a lot of fights with their spouse, or that they find they are quick to rage in ways that they can't control. And so they might get fired from a job, they might go through a divorce, and suddenly, even though they know they have everything figured out, they also suspect that something's going on. So they end up in therapy. Another presentation is that they kind of know that something's going on with them, but they don't really know what it is, and they can't really admit that there's anything wrong with them. But they do want to explore things. They have enough flexibility within their personality to say, I would like to explore my childhood or the way that I think or philosophies that I should be adhering to. And they might even seek out a therapist that they perceive as having a lot of intelligence. For a lot of people like this, it's incredibly important that they find someone that they believe to be at their level intellectually wise. And so they might seek out a therapist, and when they come to my office, the beginning of therapy can feel very without foundation, because I don't know. I keep asking them like what they want, and they keep saying exploration, and I'm like, okay, what do you want to explore? And then they might explore certain things, but at the end of every session, it feels like it's not, because there are people that want to explore things, but the real issue is with these folks is they're not actually wanting to explore things. They keep running into a barrier. They have some part of their motivation and their personality that's saying, I need help, but another part of them is saying, no, no, no. So they do this limbo zone in therapy where they're kind of exploring, but not really. And so once I detect that, then I do a lot of various things based on what's being presented, and I'll test the waters. I'm trying to connect with this part of them, and I'm trying to soothe this part of them. I'm like, hey, it's, you don't need that. It's okay. The barrier's fine, but this part is a good part. Let's let it over the barrier sometimes. That's the visual I guess I have in my mind right now, but. And there's other presentations too, but at any rate, David's now asking, so you identify in prison that you were sad, depressed, something was happening. What was going on there? So this will be very interesting to see how Andrew Tate responds, because if he has it in him and he also trusts David and he is willing to share with the entire world on the internet, then he might say something like, well, yeah, it was a pretty dark moment for me. But but at the very least, he would admit that he does have human emotion. But there's another possibility that because if I were in David's shoes, I wouldn't ask this question at this point, because I would worry that I would step on a landmine. And the risk here is that Andrew Tate could, one, just walk out. That'll happen sometimes. But the other is that he'll say, well, I said depression, but, everything, it's astonishing how denial works for people. And when you're really concentrating on a client and you see them within the same sentence or paragraph completely contradict themselves, you see that transition from, saying something to denying it. And I don't judge it. I do it too. We all do it. There's a reason for that. But there's a possibility that he'll just go into complete denial. Although he's already led the way. So let's see what Andrew Tate does here. Today's video is sponsored by Ada. So I got COVID recently. It was probably the sickest I've ever been in my entire life. It was the worst. Well, did you know there are treatments you can take for COVID-19? And that means that there's something you can do if you get COVID, things you can do to avoid getting really sick. And that's where Ada comes in. You take their free questionnaire online. I've taken it. It's confidential. And you find out if you or a loved one may be eligible for treatment. If eligible, you can talk to a clinician via telehealth within 2 hours. And if prescribed, you can pick up your treatment from a local pharmacy. So click the link below to find out if you are eligible and learn more about treatment options.
What was happening?
Well, there's a lot of uncertainty, which is the first thing
That has to be scary.
It is scary.
And then David very adeptly identifies with the emotion for therapists and really for parents, for teachers, just friends. This is a very good thing to keep in mind, that when people first present, I'll be talking to other therapists who obviously have a lot of emotional intelligence, and even those folks will frame things intellectually. They will intellectualize as a defense. So what happened was fear, was the terrifying feeling that Andrew Tate was going through because of the uncertainty. The uncertainty was happening of, will I be in prison forever? Will everything fall apart for me? Will I have no more fans? It's terrifying. You could say it's justified that he has that terror, but whatever. He has that terrifying feeling, but he intellectualizes that as he recalls it and says, there was a lot of uncertainty. The therapist, again, friend, listener, parent, teacher, it can help if you think that it's safe enough to do this, to say, wow, that must have been terrifying. And the fact that Andrew Tate responded, the fact that Andrew Tate even presented something that David could respond means that Andrew Tate is flexible enough, healthy enough, if you will, and trusts David enough to say such a thing. And maybe he learned something in prison that he needed to talk about this more. So I don't know. Who knows? But he says uncertainty. David says that must have been terrifying. And he says it in an empathetic way. And then Andrew Tate says, yes, it was terrifying. That's when you know therapy is working or a conversation is working. When, as David intuits very quickly, and might have even been kind of setting up or trying to get to this place, I wouldn't be surprised if David didn't have a plan, but was acting intuitively, but had kind of a general direction that he wanted to go. That's typical, because it's the thing that happens with novice therapists. They tend to make a lot of plans because they're really nervous about providing therapy. And so, the night before, they'll be like okay, I want to do this. I want to get here. I want to get here. 99.99% of the time, those plans are completely thrown out the window because you cannot predict what'll happen in a session, even with clients that are fairly predictable. Anyway, so David, asked that question, and then Andrew's like, the quickness, right? You're past someone's defenses. And the fact that Andrew Tate, eye contact, that's another kind of thing to watch, is that when when does Andrew Tate look at his eyes as opposed to not? For people who present like this, and I don't know Andrew Tate's personality, but people who present like this typically have a background, an upbringing in which they were harmed and or neglected fairly significantly. And early in life, at the age of 12 months old, they learned it was better not to have eye contact, because to have eye contact meant that you were going to get hurt or rejected. And so it's just better to turn away and to not be noticed, or to just focus on something else. And so when they're exploring and having a conversation, they will tend to do this. If you ever notice, it's not something that's always eye contact is kind of complicated. Some people just need to think, and so they will not look at your face because it's easier for them to concentrate if they're sort of just looking into the void. But, and there's a lot of pseudoscience around eye movements. It's all nonsense. Science has debunked it 1,000 times over. But eye contact is something that will show patterns and does have indications of something potentially. Anyway, but he locks in on David. Like, let's rewatch that.
Depressive feelings and sadness in prison. What were the thoughts that were coming up? What was happening?
Well, there's a lot of uncertainty, which is the first thing
That has to be scary.
It is scary. It's scary.
And also,
So if I had a supervisee, a trainee in my university, or someone I was supervising who showed me a clip like this, I would really highlight how well they nailed that. They set up the question, not manipulatively, but they intuited to ask, what was it like there? And also the delivery that David has. He is natural. He doesn't come across like he's trying to get him, right? It comes across like he's a human being, like he's asking from his own heart, not from his head. So he's asking that question. Andrew Tate responds, and then immediately David says, it must have been, in the natural way that he responds, that must have been terrifying. I could role play a robotic version of that, like, that must have been terrifying. I don't know. So with my trainees and myself, when I was first becoming a therapist, you're often terrified of what it is to be a therapist. And so you just want a prescription. It's like, tell me what to do. And you end up absorbing these listening techniques, and then you try to follow those rules. But when you're thinking about them too much, they don't come from your soul, from your heart, from your humanness, and other people will be put off by that, obviously. So you have to get so used to those techniques such that they just naturally fly out of you, emerging from your humanness, which it did seemingly for David. And I think Andrew Tate responded to that in that way.
He was totally in control of your world, of your life. And that's almost like an imperative for you. Correct. And that gives you power. And all of a sudden you're thrust into a situation where you're essentially helpless.
Well, you just nailed it. You completely nailed it, because I was exactly about to say it's the uncertainty that I struggle with the most, because in my life, I'm in charge of everything. I know exactly how everything works, and I'm the boss, and I get to control absolutely everything. And this is the first time in a long time I'm in a scenario where I have no power whatsoever, no influence, basically. I don't know what's going to happen. Nobody else knows what's going to happen.
So that's interesting. And I'm guessing that David is picking up on this, that Andrew Tate is, I don't know if he knows he's revealing this, but he's essentially revealing that he has a complex or a need for the defense that involves him constantly being in control and or believing that he's in control. None of us are in control of wide swaths of our lives. For people that go through sudden medical changes will attest to that. We tend to walk around thinking, well, as long as I eat right and exercise right and take care of my body, everything will be fine. And then all of a sudden, boom, something happens, regardless of you taking care of yourself. And then you realize, oh, I guess I don't have full control over my lives. And so that notion that he believes that he's in constant control of everything is absurd. And we all benefit from recognizing that we don't have full control over things. And existentially, we really have to accept it. We have to fully embrace the reality that we don't have control over some very fundamental things. Like life itself. We all die. We don't have control over that. We don't have control over time and aging and the economy and our spouses, let alone our own behavior and psychology. So the notion that he's in constant control of everything in his life all the time, it just illuminates some need. I'm contrasting that with, the fact that he says he's in constant control is in such contrast with reality. It points to that he needs to believe and will do a lot of things to give him evidence that he's in control. And of course, that points potentially to trauma, that he was traumatized. You know, when people go through trauma early, or really throughout one's life, but particularly when it's chronic over time as a child, whether you consciously identify with this or not, you will feel very much like you have no control over things. Particularly if the chaos and the abuse and the mistreatment had to do with things like your parents moving from town to town, or your parents with substance abuse can also cause children, even though the child isn't being abused directly, they feel very much out of control, like they wish they had control. And then once they get older and they have more power over their lives, one road of defensive structure is to be obsessive about control, such that you will not have to risk going back to the way things were when you were young. The irony is that when individuals do this, they tend to, in a way, recreate what happened when they were young inadvertently, because when you're a 2-year-old child, 5-year-old child, what you're wanting is security and love and attunement and safety and certainty, or at least a lack of undue uncertainty. And so when you are denied that, and there's chaos and abuse and mistreatment, and you're like, okay, if I only had control, then I would be able to get that attunement and love and safety. And then they just focus on the control. Then they grow up and they say, okay, I'm doing the control thing. And they will push out all relationships and any flexibility, because in order to be in a relationship, you have to accept that you don't have control over much. You know, with my wife, I have zero control over her and her personality. I don't even have control over myself, for crying out loud. How could I possibly have control over her? And accepting that and working within that reality and having humility around that, and allowing other people to run the show when they want to or when they need to, is a part of a relationship, and that's how things go. And so when someone dedicates themselves, obsessively to control, you could imagine that they would deny themselves any kind of relationship. So they're actually recreating the past, and that they're very alone. All right, well, let's adjourn there. So if you didn't know, we have a membership program on YouTube where people can join the channel by pledging a certain amount of money every month. And that money literally pays my bills so that I can dedicate more time to YouTube and also on Patreon, that sort of thing. And so if you wanted to do that, and as a thank you for people who become members, I am much more likely to respond and read your comments below. I will sort all the comments by membership status, and then when I have time, I at least get to those. So if you want to do that. Also, if someone is at the top tier of YouTube membership, I will offer to read a little blurb on the air on their behalf. So Fernando is a top tier member, Fernando145. Fernando wanted me to wish him and his girlfriend Kaylin a heartfelt message congratulating the two of them on their personal growth and healing that they've done over the past 3 years. We've been in personal therapy and have learned so much about ourselves, each other, and the families we came from. Yeah, absolutely. So for you, Fernando and Kaylin, absolutely. Congratulations on your personal growth and healing. It's such a wonderful thing. You know, I just love hearing about that, because all the rom-coms, it's always about the beginning, right? The meet cute and then the wedding or something. But the real romance and love and magic is down the line, long-term relationships. It's not hard to have a 1 or 2 year relationship with someone. It's much harder, and in my mind is much more romantic to put in the work once the initial vibe of massive attraction starts to diminish. A different sort of love, emerges at that point. A deeper love, I would say, a more meaningful love. That's the sort of love I have with my wife. And when we have that, the honeymoon period will continue to some extent. It's not like it goes away. But anyway, it is wonderful to hear just in and of itself. It's also wonderful to hear people who might consume my content, because that is a major component of what I consider to be the mission of my life and my career, is to spread this knowledge and help people in this way, and to hear that some people are potentially using that information as a couple. And then it's really heartwarming when I learn that couples actually will watch my channel together. It will make me feel, I don't know, it's very cute to me to imagine, you're just watching entertainment, I suppose, but it's also, I imagine, an opportunity to reflect and maybe turn to your partner and say, like, so does that apply to us? And then, you can talk about it amongst yourself and go to therapy. So yeah, it's really commendable. When you hit that point in a long-term relationship where things start to get a little hairy, a little conflictual, it's so easy just to run. It's so easy to break up. And maybe that's for the best. But it's a whole other thing to dedicate yourself to trying to fully understand, as best as you can, understand your partner, and to get to know yourself, to work on your traumas, to have compassion for your partner's traumas. Almost all the time, the things that annoy you about your partner has to do with their traumas, whether your partner knows it or not. And it doesn't mean you have to put up with it. It just means that when you run into those sorts of issues in your partner, then you are given an opportunity to, as a couple, work on that. And for you, Fernando and Keelan, you have done that. And it's such a wonderful thing. And if you end up having kids, then all of that work gets passed along to your kids in obvious ways. So yeah, congratulations to the two of you. And take care of yourself, everyone, because you deserve it. You really, really do.